Well, thank you. I think Dorothy said a lot about the background of what we do. The main focus really at this point is the sex differences we see in pain. Most of us know what pain is, not to say all of us, so I'm not going to give you a definition. You can tell me what you feel, and that's pain for me. I mean, but we do experience it differently. I mean, you feel it differently than he does, and you feel it differently than she does. And we do not feel pain the same way. We do not perceive it the same way. We may have the similar mechanisms through which we perceive it, but it's different for each one of us. That difference manifests itself between us as individuals, manifests itself between the sexes. Women, as a gender, feel it differently than men do. We have data to support that. But within the gender definition, we have also data that supports there is a biological difference there. The sexes, whether it's a female versus a male, do perceive pain differently. This is one of the main topics that we're currently looking into. We're looking at the role of sex hormones, namely estrogen, testosterone, and progesterone, in defining these biological differences. Another line of study that we're looking at is the role of early life pain or early life adverse events in the sort of complex disorders that manifest in the adult. Many of us have unexplained disorders. Some of these could be very painful, like fibromyalgia, or the pain experienced with what we call functional gastrointestinal disorders, like irritable bowel syndrome. These are pains that do not have an identifiable pathology, where we cannot put our hand on the cause of the pain, yet it is there. It's the cause of deep suffering for the patient who's experiencing it, and we need to learn more about it. We find that a small group of patients with irritable bowel syndrome have or tend to have some history of childhood pain, childhood abuse, trauma, physical or psychological, and we try to pursue that and study it to the best we can. A third area at which we're looking currently is the role of neuroinflammation in pain. This is a rather novel area in the field of pain. It has to do with inflammation taking place inside our nervous system, at the level of the spinal cord, at the level of the brain, and how that can become the generator of pain, sometimes without a peripheral cause. We try to look at all of these in the context of what we call visceral pain. Visceral pain is pain that comes from the internal organs, the viscera, our inside. Why do we do that? We find that to be the most debilitating and the most difficult to treat pain. If you break your arm and you feel pain from that accident, by the time it heals, the pain largely tends to go away. But sometimes the pain from the inside doesn't go away, and this is where our focus is right now. I'll be happy to elaborate on additional areas or subtopics later on, but I'll give the stage now to Beth.
Thank you very much, everybody.